Today, we're jumping into a really fascinating medical detective story. It's a puzzle where just one name, Wartenberg, can mean a whole bunch of different and honestly pretty confusing conditions. It's a story all about hitting dead ends, making surprising discoveries, and the power of just, well, looking at a problem in a brand new way.
So let's get right into it. Our story kicks off with a patient in a lot of pain. He's a 27-year-old manual worker, and 2 years before any of this, he'd suffered a really severe injury to his forearm during an assault.
Now, the surgeons, they did an amazing job. They repaired the severed tendons in his arm, and his motor function came back just fine. But then, about 6 months later, a whole new problem pops up, and it's a terrible one. This severe, burning, neuropathic pain that's shooting right from the scar.
And this is where things get really weird. His pain was off the charts, a 92 out of 100 on a standard pain scale. I mean, that is extreme. But the go-to test for nerve damage, an electromyography, or EMG, which basically checks the electrical health of the nerves, it came back completely normal. Nothing. So you've got this huge contradiction, right? The patient is in absolute agony, but the main test designed to find the problem says everything is perfectly fine. This just sent his doctors scrambling, looking for a clue that all the conventional tests just couldn't see. Okay, so if the nerve's electrical function looks normal, maybe the problem isn't the electricity, maybe it's structural. So the doctors turned to a different tool, one that could go beyond just signals and actually look at the physical nerve itself, a high-resolution ultrasound. And boom, there it was, the smoking gun. The ultrasound laid the problem out in plain sight. On the left, you see the patient's normal, healthy nerve in his other arm. But on the right, at the site of that scar, whoa, that same nerve is swollen to 4 times its normal size. It was clearly trapped and being squeezed by all that scar tissue.
So now that they finally knew what was wrong, the solution was this really innovative and super targeted procedure called hydrodissection. The best way to think about it is it's like using a super precise, gentle stream of water to carefully free up a nerve from the scar tissue that's trapping it. It's really incredible. Using the ultrasound as a guide, they can navigate the needle to the exact spot. Then a little stream of fluid is delivered to physically release that compressed nerve. And the best part? No major surgery required. And the results? They were nothing short of remarkable. I mean, this chart says it all. You can see this clear, dramatic drop. With every single one of those 4 hydrodissection sessions, the patient's pain score went down, steadily and significantly. And after that final session, his pain score dropped all the way to 0. A complete 0. He got total relief. It meant he could finally get back to his life, back to his work, totally free from the pain that had been hounding him for so long. So, mystery solved for our patient, right? He was diagnosed with something called Wartenberg syndrome. But this is where the story gets even crazier, because that condition is constantly getting mixed up with something totally different that just happens to have the same name. Okay, you gotta get this straight. Wartenberg's syndrome, that's what our patient had, is all about the radial nerve getting trapped, and it causes sensory stuff, like pain. Wartenberg's sign, on the other hand, is about the ulnar nerve, and it's about muscle weakness. Specifically, it's when you can't pull your little finger in toward your other fingers. 2 different nerves, 2 totally different problems. And hey, don't just take my word for it. Dr. Robert Wartenberg himself described his famous sign based on this very specific thing he saw. It's an involuntary position where the little finger just kind of drifts away from the others, all because of a muscle imbalance from ulnar nerve damage. And here's a little tidbit for you. Dr. Wartenberg, who was actually a refugee from Nazi Germany who became this beloved neurology professor out in San Francisco, well, he was also an inventor. This thing here is his Wartenberg wheel. It's a simple little pinwheel, but it's a really effective tool he designed to test for pain sensitivity. You just roll it gently across the skin. But wait, the Wartenberg story doesn't stop there. Just when you think you've got it all sorted out, it turns out the name is also attached to a bunch of fakes and variations of these conditions. So check this out, the pseudo-Wartenberg sign. At a quick glance, it looks exactly like the real thing, right? The little finger is stuck, drifting away. But here's the kicker. The cause has absolutely nothing to do with an ulnar nerve problem. It's a total fake-out. So what could cause a pseudo sign? Well, it could be a few things.
It might be a direct muscle injury, like the muscle that's supposed to pull the finger in just tears away. Or maybe the opposing muscle gets too tight and shortens. It could even be a localized movement disorder called focal dystonia, which causes muscles to contract when they're not supposed to.
And to bring this all full circle, even Wartenberg syndrome itself has its own variations. You've got a low version where the nerve gets pinched down near the wrist. That just causes sensory symptoms. And then there's a high version where the nerve is compressed closer to the elbow, and that can cause not just pain, but also weakness when you try to extend your wrist. You know, that original case we talked about is such a powerful reminder. Sometimes the key to solving a painful mystery isn't some new pill or a massive surgery. It's just about choosing the right tool, the right lens, like an ultrasound, to finally see the problem that's been hiding in plain sight the whole time. It really makes you wonder, doesn't it? How many other mysteries are just waiting to be solved if we only knew how to look closer?